Hey there people, welcome to this little video that I've put together. Chances are, if you clicked on this video and you're watching, you are one of three things. You're either looking to join the army as a CMT and you're trying to find out what Phase 2 information awaits you, or you're in Phase 1 looking to see what awaits you when you get to Phase 2, or you're just looking at what we do for the sake of knowing. There's no harm in that at all. I should also let you know that this applies to Royal Air Force medics, Royal Marines medics, and Royal Navy medics. We all train together on our tri-service base because we fall under the umbrella of the DMS, the Defence Medical Services, and so we all train together in the same location. So this general course will apply to all three of the services. So in this video, it may be a bit long, but I am going to explain to you every single week everything you'll be learning and every bit of kit you're going to use to give you as much information as possible, because when I was looking at what Phase 2 medical training was like, I couldn't find no decent information on the internet at all, and so I aim to provide you with accurate and up-to-date details on what I'm currently going through, because I'm literally at the end of this process right now. So you're getting it straight from the horse's mouth, as they say. So with that being said, let me give you the generic course overview, a quick snapshot at what our Phase 2 training is like. So your first week will be your induction week. Week 2 is anatomy and physiology. Week 3 is basic life support. Week 4 is clinical skills. Weeks 5 to 6 is case studies. Weeks 7 to 9 is something known as rotations. Weeks 10 to 14 is single service. And weeks 14 to 28 is placement. That'll be either in a primary healthcare environment, which you'll learn about those when you get here, so like in a forces medical centre, or a secondary healthcare environment like the hospitals, but for security reasons I will not name or list the hospitals that we attend as part of our training. So the main thing for placement is that you get frontline, real life experience to real patients and real problems. But that's really good because it gives you a chance to put into application what you've been learning over the course of those 14 weeks, and you'll be surprised how much info you've actually soaked in and how much you can actually help once you get to those sorts of environments and this part of the course. But enough waffling, I'm wasting your time, I've wasted enough of that already. Let's jump into week 1. So week 1, what you're going to be doing, it will be your induction week. So that's basically just getting all of your generic kit issued like you did get issued when you was at basic training. If you are a Marine, chances are you've waited a couple of years to get here, so you'll be deployable anyways. So you should really have all of your own kit. You will also go through a selection of medical assessments and jabs if you are overdue any form of jab. In this time of COVID, you'll get COVID checked and you'll conduct regular LFTs whilst you're on camp. You will also most likely be CDT tested, so compulsive drug testing. Just make sure no one's done any drugs over the course of the break between Phase 1 and Phase 2. And you'll be doing introductions to different members of staff and phys. Following week 1, you start week 2, which is commonly called A&P week. Here you'll be equipped with the foundational knowledge of how the human body works and what the different systems we have in our bodies do and the roles they play. I had an edge in this because I studied anatomy and physiology in college, but it is one of the hardest weeks since a lot of people will fail here, either because they struggle to study and revise, or they don't revise and they fail. Pick which one you want to be. This is one of the first major tests you will go through as part of this course, so do try your best to pass, otherwise you'll get backcoursed and you'll have to do death by PowerPoint all over again. The different body systems you will study as part of this week go as follows. You'll learn about the musculoskeletal system, otherwise known as the MSK system, the central nervous system, otherwise known as the CNS system, the lymphatic system, digestive system, sexual reproductive systems, cardiovascular systems, circulatory systems. You will also learn about the spinal cord and the different spinal sections. You'll learn about all the different names for the bones in the skull, and you'll also learn about cell, bone and muscle fiber structures. And after all of this week, you'll spend a lot of time revising and studying, and it all culminates in a final test. So as I mentioned earlier, do try and pass that, otherwise you'll get back course and you have to do it all over again. After week 2 starts week 3, BLS week. Here you will learn about how to treat a casualty as you find them, either conscious or unconscious. You'll begin to learn the building blocks of every time you treat a casualty. Those who have studied first aid already will know about Dr. ABC, but we have a more in-depth version known as Big C, Dr. ABCDE. Nice little rhythm to it. This all culminates in a final test at the end of this week, which is a straight pass or fail, and it is a very stressful time. Other knowledge acquired at this stage includes CPR and how to administer it, introduction to catastrophic hemorrhage management, otherwise known as the Big C, Introduction to C-spine management, otherwise known as how to help a casualty avoid damaging either the bones in their neck following a C-spine injury, or how to avoid them damaging their spine following an injury where you suspect C-spine. And I promise you, you're going to use this in real life. For instance, one night I was going for a drive and I witnessed a guy overturn his car, and I went to go over to help him with the other motorists that were there, but I was the only medically qualified or trained person there. So this geezer was dropping in and out of consciousness, and using the skills I learned here at this stage, I provided him with the treatment until the paramedics arrived, and then I worked with the paramedics to stabilize him and take him to the ambulance. Trust me, you're going to use these skills, so this week is vital that you pay attention. Moving on, you'll learn how to use an oxygen canister. You'll also learn how to use a non-rebreather mask and a BV bag in conjunction with the O2 canister to provide oxygen therapy for the patient. You'll also learn how to apply tourniquets as part of the Big C management. Learn how to apply a Russell chest seal to treat a sucking chest wound. Learn how to recognize a pneumothorax and how to treat it. Learn how to use an ECB, an emergency care bandage. Learn how to use an AED, an automated external defibrillator on a casualty. And you'll also learn how to assist a non-breathing casualty with manually assisted breathing. And you'll also learn how to manage a patient's airway using kits like an OPA, the oropharyngeal airway, or an MPA, the nasopharyngeal airway. And finally, you'll learn how to write a handover known as an ATMIST, but I think ATMIST is military specific. Around week 4, you'll move on to PHC, SHC clinical skills, and care under fire. There's a lot of subjects rolled into 1 week, and here you'll learn about how to treat a casualty in a wartime scenario, for example a combat scenario. You'll also learn about the different skills you'll use in a primary healthcare environment and the skills you'll use in a secondary healthcare environment as well as other aspects of this nature. Subjects covered are as follows. You'll learn how to venipuncture, how to take bloods. You'll learn how to cannulate to give a patient fluids. You'll learn how to categorize patients using triage and how to manage triage. You'll learn how to provide advanced airway management using an iGel or surgical airway. You'll learn about emergency childbirth. Learn about advanced management of unconscious casualties, which is basically like a more in-depth version of BLS that you covered last week. You'll learn how to treat a casualty in a wartime-combat scenario and learn about permissive, non-permissive and semi-permissive environments. You'll also get introduced to the medical bergen, otherwise known as a med bergen, which is our main bit of kit. You'll get introduced to every bit of kit inside that med bergen and how you can use the kit inside that med bergen to treat casualties. You'll learn how to take a patient's observations like their SpO2, which is their oxygen saturation, their BM, which is their blood glucose or blood sugars, and learn how to take blood pressure. With this, you'll also learn the normal parameters for observations such as the ideal blood pressure, blood glucose levels and oxygen saturations, and how the patient's vitals being above or below a certain threshold can help you determine what is wrong with them so you can begin treatment, which this you'll use a lot when you're in hospital. And you'll also learn a bunch of other stuff that I can't actually remember about. So this week also produces one test just known as OBS. It's basically a test to make sure you can measure and properly read a patient's vital signs and diagnose them, and this test is normally used in conjunction with case studies week, which I'm going to move on to now. So the main focus of this week is to spend time learning about a variety of common ailments, including the signs and symptoms, the initial treatment, which is what we can do as medics upon first diagnosing the issue, and what further treatment can be applied to a patient when they get to a secondary healthcare environment like a hospital. The conditions that you'll cover this week are as follows, but they are subject to change of course as time goes on. Sepsis, which will tie into wound management, anaphylaxis, which is an allergic reaction, heat stroke or excessive exposure to heat leading to hypothermia, hypothermia, which is body temperature dropping below normal levels, and then there was one other topic in that I just can't remember for the life of me what it was. This week's ends on a test on either observations if it wasn't done the week before, and then the case studies test where you're given a scenario on the ailments that you've learned about throughout the week, and you have to identify the signs and symptoms, describe the initial treatment, and recommend further hospital treatment if you can. During weeks 7 to 9, you're going to be doing something called rotations. These are basically 3 weeks spent rotating between 3 different subjects. The class will be broken down to thirds, and you each spend a week on a given subject. 2 of the 3 subjects have a test at the end, and the topics are as follows. Pharmacy. Here you will spend a week in a mock pharmacist, learning about the different forms of medication, different legal categorizations of medicine, different legislations which govern the pharmacy world, CD and AD medications known as controlled and accountable drugs, learn how to record the outgoing CD and AD drugs, learn about how different forms of drugs are stored, You'll learn how to use a B&F book, the British National Formulary. The theoretical knowledge normally consists over the course of 2 to 3 days, and then you'll have a final theoretical test, which is pass or fail. After that, you then move on to the practical part of that week, which is spent learning about how to write pharmacy labels, how to learn the legal requirements of pharmacy medications, learn how to dispense medication to a patient, and then you have to do a final dispensing exam at the end of those 2 days. So there's a lot of information crammed into that one, and 3 tests that are theoretical, and 1 practical test at the end. So it's a very, very stressful week. Environmental health. Here you'll learn about the working environment and the duties that we have as medics in order to improve the work environment. The lessons mostly apply to living in the field, like when you're on deployment. You'll learn about the different roles of personnel in the environmental health field. Learn about the management of waste in the field, which includes human excrement like pee and poos, well, 1 or 2, whatever you want to call it, and burning trash, and learning about incinerators and all that other stuff. You'll also learn about the variety of different diseases and their categorizations, their signs and symptoms, how to prevent the spread at the source, prevent further spread to others via their routes, and finally learn how to protect the target of the infection. There's a lot of theoretical information, and there's far too much to cover here without just going on and on. But it's a load of information to take over the course this week, and there is a final test at the end of this. And finally, the final week of rotations is where you learn about how to use the MOD's internal patient management and administration system. The specific software we use, I'm not going to disclose the name of for security reasons, but it is a 3-day week. A 3-day week of easy computer work, and then there's 1 small test at the end, and then you normally get the Friday off anyways. After this, you enter the final phase of your theoretical work, weeks 10 to 14, single service. The Army will split off and do their own thing, the RAF will go off and do their own stuff, and the Royal Navy and the Royal Marines will go off and do whatever it is they do. I can't speak for the RAF and the Marines and the Navy, but I can speak for the Army, so let me give you a breakdown of what we do during our single service weeks. So for the Army, you'll brush up on your green skills that you learned in basic, and you'll have an exercise where you get to display what you still remember and show that you can operate in the field. So it's just a brush up of basic training. It's patrols, RTR drills, whatever, the whole canopy of fieldcraft, just apply that to that. And then around weeks 12 to 14 is where you brush up on the more advanced medical treatments that you'd apply to a patient when you're in a firefight scenario. This section is commonly just known as traps. You'll spend week 13 practicing for the final traps test for the final week, and then the final week on 14 is where you go and do another exercise where you put into practice and demonstrate your efficiency in treating a casualty in a wartime scenario. This is the final test before you face the most free and best part of the course, placement. So finally, we're at the pinnacle of the Phase 2 training for being a medic. Weeks 14 to 28, placement. Placement is where the entire course gets split up and you get sent across the country to work in different med centres and hospital, putting into practice what you've learned and where you'll get real life experience with real people. This part of the course will affirm whether you really want to be a medic or whether you'll figure out that you can't stand it. Training for this is one thing, but doing it for real is another. Here you will see things that can either warm your heart or break it. But finally, after ages of getting the chance to work in the field, it will give you a sense of satisfaction like no other. There's an absolute abundance of stuff you can do here. It would literally be impossible to list everything that I'd done during my time on placement. But if you're going to start this training, you'll be hearing a lot about going to placement whilst you're here from other people who are there, the staff members and so on. So you'll learn a lot about it when you get to this stage anyways. And this, to be honest, is literally all of the information that I can recall regarding Medic Phase 2 training. It obviously won't stay structured like this forever, its subjects change over time. But for now, I can imagine that what I've given you today is you could use as a useful insight as to what you can come to expect during your time at Phase 2. I hope this video has been of help, and I hope if you're here you found it useful, and if you're starting Phase 2, the very best of luck to you. Pay attention and try to enjoy it. And on that note, I'm going to end the video right here. Thank you all very much for watching. If you enjoyed it, leave a like and sub for further content like this, and I will see you all later perhaps. Bye bye.